Yeah. I know we only have an hour, so I want to give plenty of time. People are steadily coming in, though. All right. Well, good afternoon. My name is Bridget Keeley, and I'm a program director here at Midshore Behavioral Health. And on my team here, we have Rachel. She is our hub liaison. We have Katie Dilly, who is our chief executive officer. Audra Chabanier, our programs, or excuse me, programs manager. Um, Tim Wright, our chief financial officer. Greg Gibson, who is our child and adolescent supervisor. Trish Todd, who is our data and quality manager, and Caroline Smith, who is our, what is your new title? Finance manager, I think. So we're all here to answer your questions for the Coordinated Community Support Partnership Service Provider RFP that was issued on December 16th and will be due back to us January 16th. So Katie, do we just turn it over to questions? Is that how we start it?
Well, maybe just give a little overview of what the RFP's for,
Okay.
and we can do that. Sure.
Sure. So the consortium, the Maryland Community Health Resource Commission released their RFP back in December. And Midshore Behavioral Health, we are what's considered a community support partner. We were a hub pilot and now we're a full partner. So we apply on behalf of all of the providers. So we apply to continue as a community support partner, and in our application, we include the providers for the 5 Midshore counties. This year, we are applying to become the full partner for Caroline County as we were their hub pilot last year. This is a competitive award. We are not quite sure about the funding. We're hoping that it will be steady funding. We just don't know. The consortium has not, released that budget amount yet. So it's, I think from those that have been with the hub, I think it's a great program. We're offering, wonderful services to our children in the Midshore area through the state of Maryland. But we get to see the results here on the Midshore. Rachel, am I missing anything?
Just probably worth saying for those who weren't a part of the hub process last year, that it brought over $5 million in novel new funding for children's behavioral health on the Midshore. And so, yeah, there are unknowns such as how much funding and what's going to be available, but we do have results that really speak to how desperately this was needed, how well it was received by our families, and there's just so much more momentum this year. And so I hope that continues because they've just gotten a taste of some really great things. And so it's up to us to sort of shape that experience, and make the hub program and the community support partnership something that just rolls off your tongue and is real normal.
Thanks, Rachel. And our job is to be the support to the providers. We're kind of the go-between between, the local level and the consortium. We receive all your invoices, we receive your reports, but we work very closely with the schools, with the consortium, and with the National Center for School Mental Health. So it's a really great collaboration of all the different groups. Yeah, so we've just been really pleased at how this has been going for the past couple years. We're hoping that it continues. Anything else, Katie, you'd like to add to the overview?
No, I think you all did a great job. And we're just excited to have so much interest here on today's call. And really, this call serves as a support to those of you that are considering responding to the request for applicants, to have your sort of last and special time to connect with the team here at Midshore to ask any questions, lift up any concerns, and really just have your open dialogue with us, because after today, we don't normally entertain questions or correspondence until the date where the proposals are due. So this is really, we're here for you. And I think, Bridget, that's all I have.
Okay, thank you. And so I do want to start. So Tim Wright is our Chief Financial Officer, and he has to, we've only got him for about 20 minutes. So I was hoping if you have budget questions, financial questions, we could pose those first so that Tim and Caroline can answer those for you. So I guess just raise your hand will probably be the best way to get this going. John.
Hey there, can you hear me all right?
Yes.
Okay, great. John here from Hazel Health Hive. So I have a question about budget stuff. So I know you said that the CHRC funding is not really set in stone yet. So when we're preparing the budget application, if we're an existing provider, which we are, should we just use the same budget we have last year as like a baseline?
I would say yes.
Yeah.
Okay, works for me. Thank you.
Thank you. Kathy?
Yeah, I just wanted to put out there a question / comment that I shared Bridget and Rachel with you all in email, but just to make sure there's no other final comment on this. In a prior call, we had talked about vacation leave being something that needed to be put in fringe. And then when I was completing the budget for another county that was the budget was due on January 2nd, I saw that it said normal vacation leave should be put in salary, and extended vacation leave should be put in fringe. And Bob Lally did confirm that. Is that consistent with your understanding, Bridget and the Midshore team?
Yeah, Tim, that's correct, right?
Yeah, and when you say extended vacation, what exactly do you think that means?
Well, I asked Bob that question because I didn't know what that meant either. And I can tell you what he wrote. Give me just a quick second here.
I didn't know if maybe it's like your policy, whether your policy is 2 weeks, 3 weeks, or 4 weeks. But maybe if that's your written policy, that constitutes as your normal vacation.
So he wrote that that a standard employee vacation time should be reported as salary, and that examples of extended employee leave include like maternity, paternity leave, medical leave, and other situations beyond the normal 2 to 3 weeks of vacation time provided by many organizations.
Okay, so it's outside of vacation time.
Right. So,
right, okay.
So my understanding from that is that really what we call vacation leave is part of salary. It's part of the salary cost. And this other thing doesn't really, to me, sound like vacation at all. It's extraordinary circumstances where somebody has to take leave that is often covered by FMLA. So that made sense to me that that's not vacation. But I thought I remembered a conversation where at one point, and I recall CHRC folks saying at one point that vacation should be in fringe. But now I'm hearing that what most of us would call vacation is not in fringe, it's in salaries.
Yeah, we had that same conversation on one of these calls, and I agreed then that it should be in salary and not in fringe.
Right.
Yeah.
But I think there was at one point an understanding that maybe the CHRC did want it in fringe, but now they're saying they don't want it in fringe. So I just wanted to share that piece of information I got and make sure that that's what you now are hearing as well.
I think none of us really agreed with it from the beginning. So now we're on the same page to put it in salary.
Yeah.
Okay.
Okay.
Thank you, Kathy. Catherine Smithmeyer.
Hi. Well, that's good news. I hadn't heard anything about that change. Tim, if we have separate vacation and sick time, sick personal time benefits, would we view sick personal time the same way? Again, we're talking about they get sick for a couple of days, not 3 months,
I'd say so, yes.
Okay, that makes some things easier. Thank you.
It's a lot less complicated, doesn't it?
Yes. Thanks. So, my questions are, remind me, are we just trying to ask financial questions right now because Tim's short on time, or should we go ahead with all of our questions?
We are going to stick with financial first because Tim is short on time, if that's okay.
Got it.
I
Yes.
think Caroline should probably be on the call until 2, as far as I know.
Yeah,
So
we will have Caroline.
Okay. I understand, I think it's my understanding that we're still under the guidance that the cost of a fiscal audit is an indirect expense, but that we might get a different answer for some of us. We're still waiting for that. Correct, Tim?
that's what the feedback from Bob Lally is that he's still waiting to get an answer from, I think he says,
Yes.
and reach out to the Attorney General.
Okay.
And he did reach out to me yesterday. Him and I had a back and forth via email, and he had a lot of questions about how we handle it. And to me, we have other vendors and other funding sources that they directly expense their audit expense, so their audit costs. And I let Bob know that because I think he had a concern. I said, well, that's just normal sort of operating procedure for us as far as budgeting goes for our providers. So I don't think it's going to be a problem. We'll wait and see what Bob has to say about it.
Okay, great. In the the 5 mandatory appendices, one of the items was to sign a form, I forget the name of the form, the legal, financial, and regulatory compliance disclosure form. And one of the things on that form says that we've complied with all applicable, state regulations, and it lists some things. And I don't remember any of those getting my attention last time I signed it, but this time, I was wondering about what now that we have, does having an award, so for current grantees, does having an award under this grant through Midshore, does that mean that we have a contract? If our last award was over $100,000, does that mean that we have a contract that the value is over 100,000, that incurs some kind of obligation for us to do something with the Board of Elections or something like that? Am I missing anything? If you have no idea what I mean, then maybe it's not relevant.
Yeah, Caroline has probably better handle on the contracts than I do. I don't know if you have any feedback on that, Caroline.
I'm trying to remember. It's almost been a year since we've done this, so which is kind of crazy to think that we're now thinking about next year. I don't remember anything like that. I just know that with anything over $100,000, typically we ask for the audit in that
Right.
sense. But I don't know if I can remember exactly what you're referring to.
I've got,
Well,
Catherine, is it you said the legal, financial, and regulatory compliance disclosure? Is that what you're talking about?
yes, on there it has an item, I'm looking it up now,
Hold
that
on, I've got it.
says, I
I
shouldn't
pulled it up.
expect you guys to have all this memorized, should I?
This one,
Applicant, yes, number 5. Number 5, okay, so Maryland State Department of Assessments and Taxation, we know we have to show that we're in good standing, and of course, if we're supposed to pay taxes, we paid our taxes. Maryland Secretary of State, I assume that's related to like registering as an LLC or something, if we needed to do that. The Maryland Board of Elections is what I'm wondering about. Do we have some obligation because we have a contract where did I see that information? It wasn't on here. I was sort of trying to look up like, well, what would the Board of Elections have to do with it? And it has to do with a statement about charitable contributions or something.
It looks like if you go below, it's about contributions.
It's all as
Okay.
applicable. So I think
Yeah.
this is just a general form because this is you may be responsible. So I think it's just you understand that you may be responsible for. I don't know that we do any of these, do we?
Good standing for sure.
The good
No.
standing.
Yeah.
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 Okay, so I shouldn't be overthinking this one. It
Yeah,
sounds like-
they've attached these new forms this year that everyone's required to fill out. Yeah.
Okay. Okay. And then sounds like I'm overthinking that one. My last financial question was, so if we're a for-profit business and we're required to submit an income statement and balance sheet in place of the 990, right? I believe on your says that somewhere on your application. And I think we talked about this a little bit in the last meeting. And I'm wondering, like, okay, if I'll try to simplify this question. I talked to my tax accountant, and they said they don't have time to make sure that my income statement and balance sheet are correct. Even for 2024, they told me they needed to look over it, and I don't have someone on staff or lined up to do that quickly. If I submit something that the accountant says really they need to look over, can we submit a corrected one later? Because I think that's the only way. The only option.
That should- Go ahead.
I was gonna say, didn't you say you do have your 2024, correct?
I thought I could do that. And when I talked to the accountant, they said, oh, we didn't really, like, we haven't verified.
Oh.
They said
Oh.
they would have to go over it and that they don't have time to do it by the 16th. So, yeah, can I submit something and then maybe a corrected version later if they say it needs any changes?
I agree. Like Catherine, we have ours done to our knowledge. They don't get to our taxes until May, April, May. They do an extension. So our accountant, like, we haven't even looked at any of that stuff yet. So I understand the same position you're in. It's just
Well-
going to be on what Abby and I have done on our end, and then without
Yeah.
accounting review.
And I
Because we
thought
haven't done
since
end of the year.
I thought since my 2024 tax return was done, that any statement that could be produced would be correct, but they said, oh, we only did your tax return. We didn't look at that stuff, so I don't have accounting. I've never taken a single accounting class. They always make a few little changes when they look at it for me. So, what should we do, I guess, is the question.
Sorry, I was looking at Bridget, so she's kind of reaching out to me on the side here. And, yeah, her suggestion was, should they just send the most recent form? I guess the most recent, whatever you have, your most recent tax filing would probably be helpful. I would say though, if you do have an income statement, I don't necessarily, it doesn't look like it requires for it to be certified or audited or anything like that. And I would hope that whatever you provide would be grossly misstated, where it would be material, where whatever changes you made wouldn't. I think the whole purpose of this is to make sure that the applicants are in good financial standing, and hopefully, like I mentioned, if it's something that hasn't been any type of certification or looked at by your accountant, that it would be at least for the most part representative of your financial position, if that makes sense.
So we should do the best we can.
And that's all you can do, right?
That's all you can do.
Yeah.
Yeah.
Okay, thank you.
Is that done for your financial? Okay.
Yes, thanks.
Nalene, is it Nalene?
Yeah, you said it right. Thanks, Bridget. I've just some pretty simple questions, actually. So as I review the RFP that was sent out, there's a link to the budget form that's offered by the CHRC. Was there an additional one that was sent out from Midshore that was specific to Midshore, or should we just use that form?
We did send out at our last hub and spoke call, we just took it and combined it into one with several, if you serve multiple counties. We were told that we did that last year, so it's just the form on multiple tabs. So we can send that out again if you didn't receive that.
Either way, or just send me the date. I'll search for it. It just
Okay.
didn't pull up as I searched. So thank you. So so where we are applying for actually all 5 jurisdictions within Midshore, with that budget is, we would complete the full budget with all of the tabs. And then my understanding is we submit a separate proposal for each of the 5. So we would attach that same budget to each of them.
Correct. Right. Is that correct, Caroline? Is that how they?
Yeah.
'Cause they want it by county, correct?
Yeah, we do.
Okay, yeah, we can do that. And thank you. So I'll just look for that in my inbox, and thanks for sending that.
Sure.
As you mentioned, the audit, where we're unsure whether or not we can charge to the CHRC for the audit, should we include it in our budgets and then assume that we may have to remove it if required, or that's sort of an outstanding question?
It sounds like they're definitely on board for allowing it to be indirect. The question is whether or not it'll be able to be a direct expense actually within your budget line items. I would put it in there.
Put it as a direct
I would, yeah.
under other
I'm not sure what that,
expenses, or
I have to take a look at your budget. We usually use a different one internally. But if you have a line that's something like, for us, it would normally be like legal, accounting, and audit.
I mean,
okay,
I would put it there.
yeah.
okay.
It'll be easier if you add it in. It'll be easier to
take it
take
out.
it out if you have to move money around, basically. So
Yeah, absolutely.
If our
Okay,
budget
that's
doesn't
helpful.
have that line, I can't remember if we have that
can write it in.
option with Midshore, but could it go under contractual or not?
That's
and
potentially
what do you
contractual.
think?
Yeah, that would be fine. Do they not have that line item, Caroline? Is that
They
not an option?
don't. I'm looking at it
They
right
don't.
now.
Okay.
Specifically.
Yeah, I
It would be
guess.
we based
under
it off-
other or
Yeah, we based
contractual,
it off
probably.
of the budget that they had given us.
Hmm. I guess
So we might have to
contractual would
add
be
it.
fine then.
Contractually, I
Either,
think.
yeah, I guess we can make it a decision, but I
Yeah.
would just make sure it's on there somewhere and it's specified exactly what it is. I would definitely have it broken out, regardless of where you put it.
Yeah. Even if you make like a note next to it, just says like audit fees or something like that, just so that we know and we can relay that information.
Okay. And then if they don't approve it as a direct cost, it'll come out of our indirect, but at least it's in the budget.
Right.
Right.
Right. Okay.
And
I
if-
feel good about that.
And I would imagine if they do allow it to be, then we will be updating those budgets to have a line that would accommodate that.
Yeah, potentially. Okay. Those are all my financial questions. I have a few others, but we'll get to them. Thank you.
Thank you. Lauren.
Good afternoon, everyone. I've got like 3 questions. I'll try and be brief. Regarding the PTO, I put this in the chat. We went through kind of a big shift internally here at For All Seasons because it's the only grant that we were required to separate PTO from salaries. And we did that. I'm inclined to change it back, but I'm a little nervous to do that unless that's that guidance about, yes, it's okay to put PTO into salaries. It's in writing. So do you know if that's been in writing, or is that something can be sent out in an email?
I have it in writing in an email, but I don't know if that's official. I mean, Tim, maybe you could get something from Bob
Sure.
that
Yeah, I
is
can reach out to them.
official.
Okay.
I'm just a little gun shy, so I apologize. But
Nope.
it would definitely simplify things on our end if we are really good to include the PTO. I mean, we're talking about for a new employee, our PTO is 10 days PTO, 5 days sick. So it's not like extensive amounts of paid time off. But certainly would help simplify things for our grants management team if we're good to go on switching that back to how we normally manage grants. My bigger question is really, on the RFA on page, oh, well, these pages aren't numbered, but on the page that talks about financial capacity, there's some discussion about Medicaid billing, folks that are funded through Medicaid billing, if you're billing private insurers, really talking through how you're documenting those blended client fees funding sources. And I just want to make sure that it's okay. I guess twofold. It's okay that we are talking about anticipated based on previous. So if we can kind of demonstrate the logic model we're using for saying, here's what it has been, here's what we anticipate going into the next calendar year, or I guess the next grant performance period, that will be sufficient, because there's going to be some guesswork that's involved, because we don't really know what the client mix is going to be, like the payer mix for clients that we don't have yet. So are we okay to explain the logic model and how we got to those numbers? And that will be sufficient?
I think that would certainly be helpful. I mean,
Okay.
yeah, and that makes a lot of sense. It's
Mhm.
you kind of go off your historical, whatever you have, to help guide you
Mhm.
I think
forecasting.
the kind of, we don't need to go any further than this, but the reason I ask is because we're doing a lot of modeling right now for what different, what our payer mix might look like if there are shifts in Medicaid. And there might be some breaks with what has historically been the case for us, because we just don't really know what to expect, honestly. So we'll just go with, we'll explain how we're getting there as briefly as possible so that you can follow the logic of how we got there. Does that sound okay?
That sounds perfect. Thank you.
Okay. Under the financial assistance piece, we have always taken with our schools, with our school partners, we've taken the tack of, if we're going to offer financial assistance, just so that we're really clear and safe with our parity laws, that we've said if it's Talbot County Public Schools or Kent County Public Schools, we will say it's no out-of-pocket cost for everyone. So if you have insurance, we will bill your insurance. But if you have a copay or can't afford it or whatever, we've built a financial assistance pot into this grant for that. But when I read the RFA, it seems to me, and it doesn't say this outright, but it seems to me like that's not really where this is leaning. So I'm on bullet 3 of, I guess, someone put it in the chat, page 5. Yes, Rachel, page 5, where it talks about how copay support will be documented. For non-school clients, historically, we do have a sliding scale. We have a form that they fill out. It's aligned with federal poverty rates, and it's universally applied, except for these special populations. And if you want to talk more about this offline, because this is so specific to us, happy to do that. But I had some pause of, do we need to shift our strategy of including financial assistance in the way that we have been historically in this grant and in others? Because it seems like they want it to be based on financial need, not based on kind of universal, everyone gets services at no out-of-pocket cost.
It's a lot. Yeah. Might want to.
I'm sorry, I know.
Yeah.
And it's very drilled down in detail. So like I said, we can talk offline, but I know Kellyanne said it's them too.
We have wrote in for that since the grant came out, because I mean, some people have insurance, but their deductibles are outrageous, and so they can't afford that. So we've used this, but I don't, yeah, I'm right there with you there, Lauren.
And here's what I'll say, like the difference for us is certainly we do financial hardship applications. We've been doing them for literally decades, right? But what we have found, especially with schools where we're trying, the kids are in the school and we're in the school, but the parents are over here, that being able to say it's at no out-of-pocket cost without having to fill out a financial hardship application has really helped increase the enrollment in services, because it's about perception and stigma, at least some part of it, versus, well, yes, you can get them for free, but you have to prove to us that you have financial hardship. It really has, there's like a lot of friction there.
Yeah, I think it would be really helpful if you could bullet the main points and email it to us, because we're gonna have to get clarification from the consortium on this.
Can you share that answer with
Oh, yeah,
all of
well,
us? Because we've been doing the opposite. We've been collecting copays whenever there isn't apparent friction. But of course, there could be families that are not engaging with us to begin with if they know that, right? So yeah, I think if we're doing different things, some guidance on this would be helpful for all of us.
Yeah. And if you're not
Tim,
current,
can we move? I'm sorry. Can we move forward with how, if we already have a current budget that we've written in, can we move forward with doing it, structuring it the same way until we hear back? Or like, I don't know how long it'll take to get an answer, so I don't want to wait until the last minute to structure this budget. Or do you want us to wait?
I mean, I would do it the way you've been doing it. It's been approved from the consortium for the past 2 years. So, but we will get it clarified. And if someone isn't a current provider, please put your email in the chat so we can be sure to get these questions out to everyone. Or the answers to this question. Yeah.
I'll work on the bullet points today so that you can
Okay.
forward that on. That's helpful. And this will be quick. My only last question is for those that are current grantees, and I know this is kind of separate, but we just finished our audit. Do we need to be submitting that to you all for this budget cycle or for this grant period? Just wondering if we missed a step in closing out our audit.
No, I think you should submit it. Yeah.
Submit it. Okay, good.
Yep.
We'll send that over to you.
Thank you. Okay. Next, Nalene, you got your hand up again?
Yes, are we still on financial? Sorry, am I
Yeah.
muted? Okay, not muted. If we're still on financial, I can wait.
Oh, do we have any other financial questions? Go ahead, Kellyanne.
All right, I don't know why two's popping up. Just one quick thing. I'm going back to if the audit has to be indirect. I want to clarify the 15%. Caroline, you can probably help me on this, because the first year we did it, it was 15% of our total budget, and they didn't do it off monthly cost. And then I think we had one month where it was like, oh, we were a little bit over 15%. You have to take it down. If we are rolling with indirect, if that somehow comes back as what the audit needs to be under, the 15%, I'm just concerned about that. If this big chunk is going under 15%, and then our other monthly stuff that's usually under indirect, how are we going to work that?
I know
it may be different if we don't have to do that. I just want to prepare for that because of the run-in we had 1 month with no big cost in it.
Yeah, no, that's a really good question. Because I don't know if the higher ups have even thought about that as well. I don't know, Tim, if you and Bob had spoke about that.
but
Because that is a very big concern, I know, for a lot of them.
I would say we'd probably do an audit exception for that particular case. We would subtract that from the total of your accrued indirect at that point. So whatever your indirect is, a total less that shouldn't be more than 15%. Does that make sense? Okay. That's what I'm thinking anyhow.
Yeah, that's what we've done before. So that makes sense.
I have to go. It's nice talking to you all today.
Thanks, Tim.
Appreciate your time.
Thanks, Tim.
See you guys.
See ya. All right. Anyone else? Go ahead.
Summer also had a hand up. I don't think she's on
Ooh,
camera,
go
but
ahead.
we Summer Southern.
I was just gonna chime in briefly about the copay situation, but I think we got it figured out. So.
Okay.
Yeah.
Okay, Millie?
Oh, we had found some information about appendix, I think it's appendix G, that's essentially the M&D guide as a requirement for these applications. Can you tell me more about that and what you're needing?
Let me pull it up. Which one was it again?
I think appendix G, is that accurate?
Copy of student and family survey, appendix G.
No. Sydney's my colleague, she's on the call. Sydney, do you want to chime in?
Elaine, I think you're looking at page, it starts on page 96, and that's in the full RFP from
Yeah. Thank you.
CHRC, right? Is that right?
Mhm. So that's a requirement, is that a requirement for Midshore? Is that only the, if you're applying directly to the CHRC to turn in the M&D guide as part of our proposal?
Oh, I see what you're saying. I didn't see it. In the track
yours,
one,
yeah.
I didn't
don't
see that.
see it there either. And I wanted to ask, from the RFP, the required appendices, there's only just a few, but then we were referencing those other 5 documents. It's like the legal and financial forms. So am I missing that in the Midshore RFP?
The M&D?
Yeah, let's stick to that. So is the M&D required with our Midshore applications? That's my first question. I didn't see it in Midshore's RFP, but it is referenced at page 96 in the CHRC.
Pulling it up.
Thank you.
I don't know. I don't, because they break it down
turn
between
it
the 3 different,
Last year we did those once we were awarded, and we had a whole meeting, with
trying to scroll to the one.
blueprint. So I was surprised.
Yeah, I don't think it was because I literally copied and pasted everything that you guys needed. Track 1, okay.
I wonder if I'm remembering correctly, but I thought that last time we I think last time we provided to you, Rachel and Bridget, our most recent M&D report, because you did not have that. You wouldn't have had that. And maybe some other pieces, maybe like a budget. I don't remember if we gave you our narrative or something, but I think we gave you our most recent M&D report last time, but this time you would have our most recent one.
So in ours, we wrote that for anyone in Caroline County, that was we needed theirs because we don't receive theirs. But then I think Summer, where are you from, Summer? Or who was asking the question?
I mean, I'm from Caroline County Behavioral.
Okay, so yeah, so you guys do need to send us yours because we don't have it.
Okay, that's helpful. So the report, Q2 report for Caroline County, you will need, but you don't need the M&D guide, which it defines, how we're measuring everything. And we worked that through this last year with blueprint evaluation.
Right, no.
You don't need that. Okay, awesome. And then just earlier in the call, we were referencing the legal and financial forms, and I think mentioned 5 forms that are required as appendices, but I'm not seeing that on this RFP. Is it linked back to the CHRC to see that requirement? Because all I see is mandatory appendices is just the superintendent letter of support and copy of the family satisfaction survey.
So did you receive the revised? We sent a revised.
Oh, I'm looking at the old one. That's my problem.
Yep. Yep. Because we realized
There it
after
is.
the Q&A from the consortium, we
Thank you.
missed those. And so we did a revised and repost it on our website.
Thank you.
And so the
I'll
M&D,
that.
I am looking at what you're talking about, and it's for so different tracks. So the track 3, I think they are requiring M&D reports. So
Okay.
that's
Or
where we got
M&D
confused.
guides.
Yep. Yep.
Oh, okay. And do you mean report or M&D guide?
Current grantees, we need your report. New people, they would need your guide. Yeah.
Oh, okay.
But that's for a
okay.
different track.
Gotcha. Okay.
That's what I'm
that makes
reading
sense to
here.
me.
Yeah.
Perfect. Thank you. Okay. And now I see all the mandatory appendices. Thank you. I
Okay,
just had
sure.
the wrong link. Appreciate that.
Sure.
Bridget, I
Yeah.
know we're getting lost in the weeds here, but just to, I'm sorry, I don't mean to interrupt, but to pick on that question, just to clarify. Okay, so current grantees not in Caroline. So current grantees that you have been working with, not in Caroline. We do not need to give you, as part of our proposal this time, an M&D report, a metrics plan, any kind of narrative other than our
Right.
proposal and the appendices.
Correct.
listed.
We already have that. Correct.
Yeah, and even though, and I've noticed just, in the revised RFP, the Midshore revised RFP, there's a section that says current service provider requirements, and then a section that says new service proposal requirements. Those mandatory appendices are listed under new, but you've clarified that you want them from all of us.
Thank you.
So,
Yeah. I'm sorry. Yeah. I guess that's a little bit
Yeah.
confusing. Yes. Yep.
Okay.
Yep. Who's up? Lillian, are you next?
I'm good. Thank you. I'll put my hand down.
Okay. Lauren.
My biggest question is, and you may have already addressed this, so I apologize, because I'm seeing some conversation in the chat here. If we are applying for more than one county, are we providing a combined application for all counties for which we're applying in a combined budget? Or are they going to be totally separate? Because I think that I had done separate last year and then combined them or vice versa.
They need to be separate. They want a separate application for each county.
Okay. So when it comes to, and it looks like I was just looking at my email for the revised RFA, so I apologize if this is answered in there. In the one that I've got in front of me, it talks about school principals. So just talking about Kent County where we are currently, there are 5 schools that we're in. Shall I go to each school principal and get letters of support from them? Is that what I need to do? As I know it says optional, but is that the
No.
hope?
And what we have determined is we're going to do one letter of support for each county. So Midshore is going to draft the letter. We're going to send it to the schools, the superintendent or their designee, and that one letter, they're going to list all the providers in their county that they're going to support. So you just need to send us your proposal. Hopefully you've already been talking to the schools, so they're already waiting for your proposal. They're already supporting you. They're going to review them, and then they're going to put on their one letter each provider. So you guys don't have to worry about your letter, but hopefully you have reached out to schools already and have started those conversations. There's been emails that have been going out, but there's been a lot of correspondence going back after our hub and spoke call before Christmas. And we just determined, we reached out to the schools, and that's the best way to handle this because it's so many letters that we're just going to do one letter, list out the providers. So you guys don't have to worry about that piece.
Thank you very much for doing that.
That makes sense?
I think
Yeah.
that's, yeah, absolutely.
Okay.
No, that works for me. That's all. I just wanted to make sure that we're giving you the format that you need. So we'll go ahead and
Yep.
prepare too.
Okay, great. Anyone else? Are there any questions in the chat? Okay, a lot of questions about the letters. Colleen, we answered your question.
And thank you guys too for your grace and for sometimes pointing out the obvious and sometimes finding a little detail that we need to reinforce. I mean, that's that to me, the best part of our trip for Florida and working with the National Center is this collaboration. And so like as you guys are talking about the M&D and stuff, like I just know we could pick up the phone and call parent. That's the relationship that we have with them at the CHRC. And so it is nice to sort of see that coming. And so we appreciate your grace and smiles. We're getting there. Thank you guys.
Thanks, Rachel. It's definitely a large project that we all have to work together. Catherine.
I think this is more of a suggestion / request than a question, but I just wanted to pass along to Midshore that the feedback that we've received in the county, which is Queen Anne's where we are now, and in some other counties where we thought maybe we would expand, but it's not like we're going to. We certainly received some feedback about space issues, right? There seemed to be a number of schools and even the whole LEA that told us they don't have space for more providers, or even in Queen Anne, in some cases for our providers to increase our hours, even though in many cases they still have the demand. The demand is still there. There's still some unmet need, but lack of space. And so I think it would be amazing if somehow Midshore could work with some of the schools to put up some portables, which is probably a much taller order than I think it is. And I'm just throwing that idea out there. Because maybe, next year or the following year, I just wonder, it seems like we've got a lot of providers now and the space is becoming shorter than the providers are. The shortage was providers. Now it seems to be shifting to be space. Anyway, that's all.
Thank you. Well, Abby.
Yeah, not really a quick question, so I'll keep it short and sweet. But for those that have already applied in the past and are current providers, I noticed one little change, and we had to get an actual certificate of good standing. I don't know if anybody has read that, but it said screenshots weren't included or accepted this year, and you have to pay for that. So if you're someone who's doing the grant and you don't have access to that financial side, I just want people to be mindful of that so you don't run into the barrier last minute, if I'm reading it correctly. But I had to go on and download it and pay for that. And then it was extra money to get it downloaded same day. We've never had to do that in the past, so that was new.
Thank you.
Yeah, that's great information. Thank you, Abby.
I just posted a link to our website that has the revised RFP for anyone that's looking for it.
Yeah, I have to find what page it was on.
Hold on, let me pull it up. It's
on F under mandatory appendices. And correct me if I'm wrong, because this is all still foreign language to me. But I took that as I had to request the certificate.
Yep.
You can do an instant download where they email it right to you. But of course, there's a fee with that. If not, it took 14 days to get it, which we're already past that. So just so people have that heads up.
And I did want to also bring up, this question came up, the G on their mandatory appendices is a behavioral health license. So if you have a license through BHA, please send that. If not, they have requested individual therapist license for those doing the service. So just for clarity, because that was brought up. Lauren?
Would you like all of our licenses for all locations or just in the county that we're applying for?
Just the counties that you're applying for. That's fine, thanks.
You don't need our headquarters. The reason I ask is because I don't know offhand of the volume. But we're doing school-based services and clinic-based services, but some of the services, especially our psych services, are being provided by a provider that's in one of our offices, but via telehealth.
Then go ahead and send that too, just to be safe. Thank
Sure.
you. Okay. Anything else? So we will be, once I receive the information from Lauren, we will be proposing the question to the consortium about the PTO to get that in writing. And we will email that response to everyone. And thank you for your emails that were listed. Are there any other outstanding issues that I didn't jot down? We're still waiting on the audit question. But like Tim said, just put it as a line item. And it sounds like we were going to put it under contractual for right now and just write out what it is. Catherine?
If we're only applying in one county, should we go ahead and use the multi-county budget template? I'm assuming we should. There's not a
Wait, what was
different.
repeat that? Can you repeat that?
If we're only applying in one county, should we use the full multi-county budget template? In other words, you don't have a different one for us, right? For a single county, like you did in the beginning, we should just use the multi-county.
Yes, and just fill out the one county that you need. Yep.
Yeah.
But
Or
Catherine, if you scroll over on the budget template, there's a Queen Anne's tab.
Right.
Yep.
Okay.
Yes, I'm just.
Is that what we would do if like we're
Yep.
only applying for Queen Anne's?
Or-
We fill it out on Queen Anne's, right? Okay.
Caroline, would you rather they just fill out the sheet? They don't need to do the one with the multi-tabs if they're just doing one county?
Was this provided by them? This,
So we took,
Oh.
the providers that our current provider said last year, Taylor created a workbook for those in multiple counties. So it would be easy for them to compile it all. But if they're just doing one county, should they just fill out the one form?
yeah, just fill out the one form. So I wasn't really a part of this last year, so I'm kind of trying to get up to speed with everyone else. Yeah, just the one tab is fine, just the one form. Don't make more work for yourselves.
Thank you.
Caroline, when you say the one tab, is that the combined track 1 and 3 budget required template, or are we doing the one county we're applying for? Because we see them both on the workbook. Does that matter, or just as long as it's one for you?
I think as long as it's just one. I don't know if I've seen what you guys are talking about, so I would imagine just one is fine.
I'm pulling it up.
Sorry, don't interrupt. I have a different question.
I don't know who said that. Go ahead.
The Advancing School Mental Health Conference, it sounds like it was such a good opportunity to network. Is it appropriate to include the cost of attending that for some of our staff in our budgets?
I would say yes.
Yeah.
I think the CHRC even wanted you to do that. That was like,
excellent.
they wanted us to attend and allowed us to do that as
And they
part
allowed
of
it to be direct. Okay.
Mhm.
Did you
They
put it
said it-
under what line
Yeah, that's
item?
great.
I'm going to defer to Abby
Just
on that.
I should just pull up the budget and look. I've got my
I didn't somehow miss the news about that conference until they were asking who's going, who's attending.
Yeah.
It was coming up. So hopefully
I
won't miss the
believe
news
I
this
put it
time.
in staff training and then in my narrative, I
Mhm.
put in what that was going to entail,
Okay.
under that.
Okay.
Don't we already have the information for next year's conference?
I said Nashville this morning.
Yeah,
So that's what I was just on their website trying to find because the per diem rates would be different, right?
yes. Based on
I'm
the
not seeing it on
location.
their, is there somewhere I can look to go find that, Katie, or anyone? I'm on the University of Maryland School of Medicine's website and it just has the 2025 on it right now.
Let me just Google the conference and look. They noted that they call for proposals is next month too.
Rachel's
so-
got,
Yeah, so it will be December 1st to 4th, and it'll be in Nashville
yeah, there
Wonderful.
we go.
for 2026.
And I was pulling up the budget. So that's the budget, this track 1 and 3 service provider budget and the narrative. Those, if you're just doing single, those are the two documents. And then if you do multiple county, you need one for each county.
For the narrative.
Correct.
I feel like I've somehow lost track of the narrative. Oh, we're supposed to
on.
use the one
Hold on,
we
I'll show
used
you.
last. Oh, you sent us a fresh one recently, right?
We did, but here on the
Okay.
application, if you click here, it brings you right to the consortium's budget narrative template. See that? Can you see there?
Yes, that's in your RFP. So we should just use that one.
Yeah, this is ours, but it links right to theirs.
Okay. For some reason, I thought maybe you sent us something. I don't know. I thought maybe you sent us something slightly different from theirs, but no. Because you talked about a report versus a narrative. in one
Are
of the
you talking
emails.
about the progress report, the service provider's progress update? Is that what you're speaking about, Dr. Smithmeyer?
Um,
We were
We-
trying to merge some of the forms together and make it a little more cohesive this morning. I have the completed form for Q2 that I'll send to you and other people that are involved in the grant for this round.
All right, okay, so that's
Yeah.
the Q2 document is what was recently updated, but what goes in with our proposal is exactly what the consortium provides us with. Okay. Okay. And we can link to that from, okay, got it. Thank you.
Bridget, I see a question from Latrice Gray in the chat. Latrice, I think if memory serves me right, did you do some work in Caroline County this year?
Somerset, I'm sorry, I have a delay over here.
Hey, it's
I was
okay.
in
I'm glad to see
Somerset
you.
County this year. Yeah. Thank you. Good to see you as well. And my question was, applying through the Midshore, I would be new here. Would that be considered a track 1?
Yes, you're applying to us and we're track 1.
Okay, great. Thank you.
Whew. Anything else? It's 2:00. All right, and I think most of you probably were on the RFA form, the consortium, but they have a link for their Q&A on their website, and it is very helpful also. If you have any other specific questions, can't hurt just to listen in, because I found it very informative. So.
I think too, I think my past experience, just for anyone who's new doing this, during this time period coming up when you said you really can't answer questions from us because obviously you need to treat every applicant equitably, I feel like we were still able to get some answers from the CHRC if we really had a technical question. So I think we can do that as far as I know.
Yeah, I mean, I've been reaching out to them and they've been answering, so yeah, but really we're not supposed to. I don't understand that last question. Existing list outlines what's required for each county.
Yeah, I'm not exactly sure either, Bridget. Are you existing list that outlines what's required? Are you speaking about maybe requirements for the grant application or the requirements for the service providers?
Hanitha, can you come off mute?
The service provider requirements for the service county.
So I'm wondering if what she's referring to is what each county is looking for. So if you're looking to write a proposal for a county, I think it's pretty clear that you would need to talk to the mental health coordinator and get that guidance first of what they're looking for in their county.
And I believe we have them listed. Let me double check. I think we have each mental health coordinator on our website.
We do.
We do. I'll put the link here. So if you need to know who to reach out to.
The other thing that you'll notice there, and I've put the link, is for the hub program on our website, in terms of looking for what everybody's looking for. If you refer to the needs assessment that's there in our hub section, that'll give you a good idea of what's going on county to county, but also where some needs or gaps may be. So that's also a really good place to look and consider it as a launching pad.
All right. Well, we will save this recording on our website. It'll probably be up in the next day or so as soon as we can get it downloaded and posted. And we will send out an email out as soon as we get an answer about the PTO. I appreciate all you joining. I wish you the best of luck. And I look forward to seeing all your proposals.
Thanks, everyone.
Thanks.
Thank you for your
Thank
interest,
you.
everybody.
Thank you.
Bye-bye.